This is 𝗙𝗀𝘁𝗲𝗏, and you are watching my channel, Knowledge for Quality of Life. Friends, today's topic is very important one, and it's very tricky topic as well. So I hope that you can watch this thing till the end. And if you can't see it in one sitting, watch it in few segments. But each and every information which I'm going to be sharing, it's very critical for those who need really help, because I'm dealing myself in our household. My wife is dealing with osteopenia, and today's topic we are talking about osteopenia or osteoporosis. Now, before I go into the detail, what we are going to look into, that what is it actually, what is osteoporosis or what is osteopenia, and how we can assess it, and what can we do about it. So I'm not going to be going the what part, the medical protocol, which you can deal with your doctor. I'm dealing purely on a natural basis, the way I'm dealing with my wife. And I will share my experiences, the main understanding of this silent disease. So let me share my screen with you. So what you're seeing here is we are going to define what is osteoporosis first. So osteoporosis is a disease that causes bone to become weak and more likely to break. So basically the bone formation, if you look at this picture here, this is a normal bone and this is osteoporotic bone, and it creates the pores over time. What happens that, the cell segments of the bone, because bone is always remodeling, it's constantly remodeling throughout our lives. So when the bone cells and bone tissues are being killed, with the cell mechanism, we call it osteoclast, and the new cell formation is taking place in the bone tissue matrix is osteoblast. And these two are constantly in sync. If the osteoclast is more than osteoblast, then you're going to see the leaching of the bone tissues more and rebuilding is less, and it will reflect in your test results, whatever the test assessment tool one would use. So we need to make sure that our bone synthesis is at a higher level than it's defragmenting at whatever level it is. So we have to do certain due diligence in order to achieve that. So this osteoclast and osteoblast is always, in sync throughout our lives. So it's basically a hormone-related issue. Particularly, it's seen in females, but males are not spared. It's rarely common in men, but it's pretty common in females. And as we know that 40 is the physiological tipping point for us when in age wise, and we are down the hill after 40. So it just we up to 40, we have a bone building age, and it just peaks at the 40, and then it goes down the hill after 40, and particularly after 50 it just takes its course, a pretty downfall steep curve. And these are basically, this issue is a hormone driven issue. So in females, it's driven by estrogen, and males, it's driven by testosterone. So there are medications which also aggravates this issue. One has to be careful. So whenever you get any medication for any ailment, you need to figure it out with your doctor that what are the side effects. Is it going to leach my bone? Am I going to lose my bone density? Because if you don't look into those things, then eventually your DEXA results or your assessment results will be down the hill. It's going down, and it's what happens that once you lose your density, basically your bones becomes much more fragile, and it's easy to break during the fall. Whenever we fall, that if it's too much porous bones, then the shear fracture is going to be very evident, and that's what we are trying to save an individual from. And basically, the lifestyle is also an issue, because a low diet in calcium. I'll come to that point, because this is a myth that calcium is only plays into this osteoporosis phenomena. It's more than that. Calcium is just one element. Or vitamin D, which we know that vitamin D increases the calcium absorption by 20 folds. So vitamin D is important. Lack of weight-bearing exercises. Heavy smoking also can increase the risk. And some symptoms which we see, the symptoms of osteoporosis, like sudden severe back pain, difficulty in twisting and bending of the body, loss of height, curving of the spine, and so on and so forth. But overall, this osteoporosis or osteopenia, the phenomena, is so silent that we don't get any symptoms whatsoever unless somebody has a fall and you have a fracture in the bone. What assessment tools are available? There are two assessment tools. The number one, which is established for a long time, it's called DEXA scan. It's based on the X-rays, and it passes the X-rays through the bone, and it measures the density. So basically, density is reported into the some sort of a score, which we call T-score, and from anywhere from 0 to -1 is considered normal. Anything between -1 to -2.5 is considered osteopenia, and anything goes in the negative range beyond -2.5 is full-blown osteoporosis. So it's very tricky as far as the DEXA is concerned, because DEXA is a test which I found out. We've been doing DEXA over the years, because we used to run the DEXA on my wife every 3 years, because I don't want her to get exposed through X-rays every year. So I chose to go 3 years, and we found out that there are some drawbacks to DEXA through my reading and scientific literature, particularly in petite female, who are short, who have a skinny skeleton, and it has a skew of about 30% result by the DEXA. Because remember that DEXA bone density it has a measure of height. So if somebody is a petite female, shorter in height, then that number can be skewed one way or the other. And again, the DEXA is dependent on the person, the technician who's doing the DEXA assessment, how you are laying out the patient. So if you have two person doing on the same DEXA machine, chances are that you can have some variation in the results. So it's not 100% foolproof, but it's very established diagnostic tool which have been around for years and years. But recently, there is a new tool came from Italy. It's called 𝗥𝗚𝘁𝗍 REMS, and it's been approved by FDA. It's not approved by insurance yet because it's much cheaper, and I don't know why. Eventually, it may get approved by the insurance companies, but there's not to be a lot of money to be made in 𝗥𝗚𝘁 as compared to the DEXA. So maybe there's a medical establishment, they have some kind of agenda there. I don't know about that, but I've been waiting for 𝗥𝗚𝘁 REMS for some time, and it started penetrating into the East Coast. And recently, last May, it came to Chicagoland area as well. There's one center in Schaumburg location, and there's one center in Wilmette location. So we went there, and we got the test done. this year. Now, 𝗥𝗏𝘁 is like a purely ultrasound. It's not X-ray based, so it's much safer tool to assess the bone density as compared to the DEXA. Now, not only it's ultrasound based, so basically just like, when they do the pregnant women, ultrasound, that's the same technique. They put the gel and then they have a transducer, they roll it on onto the locations where they are measuring. Basically, they are measuring the spine between L1 and L4, and they are looking at the hip, and they are looking at the neck of the femur. So neck of the femur, that what are the odds that if somebody falls down on the hip area, what are the chances that it can fracture, it can break. So those type of measurement it gives you a T-score. But one beautiful thing here in 𝗥𝗏𝘁 REMS, that it gives you a fragility index. Now, fragility index is a function of how one's bones are fragile. So in case of a fall, so negative density, it's not all bad, because a person who's a petite person and skeleton is smaller than the normal person, a taller person, you can have a fragility index much better, because bones needs to be more ductile than brittle. If you have a fragile bone, it means that it's brittle, and in case of a fall, it's easier to break. So it gives you this test, 𝗥𝗏𝘁 REMS gives you that fragility index as well. So on a T-score basis, my wife is in osteopenia at two locations, and one location osteoporosis, but her fragility index was 24. Anything below 37 is considered good. It means that the bones are not fragile as it's showing on the T-score. So that is one thing to good to know, that it gives you a fragility index, whereas DEXA doesn't give you a fragility index. So I thought that I'm going to share with you. Then basically 𝗥𝗏𝘁 can be run frequently, because it's not radiation based, it's not X-ray based. So it can be used as a monitoring tool. It costs around $250 or so in Chicagoland area. And when to use the DEXA? Of course, initial bone density assessment. Normally, doctors use DEXA because that's approved technique through the insurance companies. It's covered by the insurance. That's why they have a vested interest in recommending DEXA. But myself, going forward, I'll be doing 𝗥𝗏𝘁 REMS, even though I have to pay from my pocket, but that's okay, because my main focus is to monitor the fragility index. Because whatever the protocol we are doing at home, I want to make sure that we are improving inch by inch in that fragility index, if not going worse. This is what it is. When one would choose 𝗥𝗏𝘁 REMS, of course, for pregnant women who are concerned about the radiation exposure, this is a great tool. Then looking at the bone quality just beyond density, because it doesn't give you only T-score, it gives you a fragility index. That's what I'm talking about. And frequently monitoring of osteopenia and osteoporosis is very helpful in case of a 𝗥𝗏𝘁 REMS as compared to the DEXA. Now, let me come to the nutritional part. As I said earlier, that I'm not going to get into the details of the medicine protocol, because normally what happens that once somebody is in the range of osteopenia or osteoporosis, your doctor is going to give you either Prolia shot or Fosamax or any other medication, and that medication, based on what I have read, that it gives you a patches. It's not building your bone organically from inside out, but it gives you a patches in such a way that it improves the bone density. Bone density, the whole idea is not to improve the bone density only. The whole idea is to improve the fragility index, make the bones less fragile. Because we remember from our basic definition of chemistry, density is nothing but mass per unit volume. So if you have a less, particularly as I said, that petite females, shorter females, and skinny skeleton females will have a lesser mass and lesser height. So of course the density is going to be less, but it doesn't mean always that your bones are fragile. You can be a fragility index at a lower rate, as I saw in my wife's case, that her fragility index was 24. So these are the few nutrients which is required to build a bone matrix. Bone is not just a calcium. It's not just a magnesium. It's a multiple things plays at a big synthetic role. It's in the synthesis of the bone matrix, and we have to be mindful of everything. So I'm going to go little by little in everything. Calcium is about recommended dose is 800 to 1200 milligram for bone development, strength, and rigidity. Now, I don't recommend my wife doesn't take any calcium supplement, because calcium is abundantly available in food. You take, and I don't mean only dairy, you take a kale, you take greens, you can list your, daily intakes, what you're eating, and, you can come up with easily 1200 milligram of calcium a day. If not, then, split in half supplement and go with the natural supplement with 600 milligrams of, calcium supplement, and then fulfill the rest through the food intake. Magnesium is very important mineral. As I said, I have done separate vlog on magnesium. Please watch it, as it's a master mineral, and this mineral plays a very vital role in bone matrix formulation. Calcium absorption, vitamin D metabolism, and regulation and preservation of the bone. Actually, magnesium is involved in more than 300 enzymatic functions. Vitamin D is the main component of our whole being, actually. I have done enough vlogs on vitamin D, because vitamin D, what it does, that it magnifies the calcium absorption into our gut system by 20-fold. So now that absorption is there. Now how to take that calcium from the arteries, from the blood level to the bones, is being done by the vitamin K. Vitamin K, when I say vitamin K, is vitamin K2. All right. So there is a difference between vitamin K1 and vitamin K2. Vitamin K1 is for the clotting power of the blood, which is plenty available in greens, in vegetables, and vitamin K2 is available in the fermented foods. And if you are not in eating the fermented foods such as cheese, sauerkraut, kimchi, natto. Natto is the most potent food on the planet for vitamin K2. But I will warn you that, K2 has MK7. So I will come into a bit for ApoE genotype variation, because we all carry different ApoEs, and we have to be mindful that what type of K2 we consume. Just give me a second and I'll come back at the end for vitamin K2 explanation further. Zinc is also a very critical element, trace mineral in building, recycling, and healing of the bone tissue. Manganese has a special role in bone formation and mineralization. Boron, these are all trace minerals. You don't need a whole lot. You need a very tiny amount. So if you have a variety of diet in your various meals throughout the day, or 2 times or 3 times, whatever the meal consumptions you are on, then you should be able to fulfill these trace minerals like manganese, zinc, boron. Vitamin K2, of course, you cannot fulfill with only food unless you are eating natto. But vitamin D, of course, you need to supplement. There is not enough in the food. Magnesium, you have to supplement. There is not enough in the food. You can partly get through the food. Calcium is abundantly in the food. And then two more important thing here, which is not listed, which I would include, is potassium and phosphorus. These are the two another elements which are part of the bone matrix. So make sure that you are consuming foods, variety of foods which are rich in phosphorus and potassium as well. The most important thing here is protein. Protein is 50% of the bone collagen. So the rule of thumb is here given that 50 to 70 gram of protein on average, or 1 gram protein per kilogram of body weight. According to the late Dr. Robert Hinney, who has spent his 40, 50 years of life in studying the bone synthesis and bone rebuilding, and he was one of the expert in this area. And according to him, he's saying that one would need 1.2 to 1.5 grams of protein per kilogram of body weight. So let's say if somebody is 110 pounds of weight, so you divide that 110 by 2.2, whatever the number you get. So why 2.2? Because there is 2.2 pounds in 1 kilogram. So you divide 110 divided by 2.2, whatever the result you get, you multiply by 1.2 if you are using 1.2, just like I'm using in my wife's case. So 1.2 divided by, in my wife's case, I can calculate that she takes about 50 grams of protein because based on her body weight. So now 50 grams throughout the day. Now you can divide that 50 grams of protein in 3 meals, depending on how you eat, what your pattern is. The second important thing is here, besides the nutrients in your diet, is omega-3 fatty acids. And omega-3 is shown in research that, it helps in reducing the hip fracture. So it means that, if it reduces the fracture, it means that it reduces your fragility index. So it's good, so it's going to protect one's, and we know that omega-3 is not only important in the case of bones, but it's also good in the heart issue, heart-related issues, or in neurodegenerative diseases as well. So omega-3 fatty acids is very crucial. I personally take 2 times wild-caught salmon a week, and then we take krill oil as a supplement, 1,000 milligram daily, and that's how we fulfill our omega-3 EPA and DHA. Now, let me share some thoughts on vitamin K2, because some of the viewers in the past asked me questions about the clearance rate when I did my separate vlog on the vitamin K2. So now we have 3 types of allele. Remember that. ApoE genotype, allele 2, allele 3, and allele 4. Now, based on these SNPs, these 3 SNPs, main SNPs, and we inherited 1 SNP from dad and 1 SNP from mom. So like, for instance, I have my ApoE genotype is 3-3. So somebody can be 2-2. Altogether, there is a 6 combination. So from main allele of 2, 3, and 4, you can have 2-2, 2-3, 2-4, 3-3, 3-4, and 4-4. So this is 6 combination. Now, K2 clearance from the body depends on what genotype one carries. A lot of people who are carrying main type of 2 has a very slow clearance rate of vitamin K2. Now, remember that, when you have a slow clearance, you have to take very tiny amount. When you have a fast clearance, that tiny amount is not going to do you any good. So the allele 2 has the slowest clearance, allele 3 is the typical clearance, and allele 4 is the highest clearance, fastest clearance of K2. So if somebody is 4, and if he or she takes 100 microgram, which is mostly recommended by doctors, which I've seen in various vlogs on YouTube, it's not going to do you any good because, my wife was in the same boat. She is 3-4. So she clears vitamin K2 pretty fast. Now, remember that vitamin K2 has a half-life. Every vitamin has its own half-life. Half-life, I explained in my previous vlogs, it defines that, the potency of that vitamin reduces by 50% by whatever the amount of time it takes. So vitamin K2 comes in two main forms, vitamin K2 MK4 and vitamin K2 MK7. MK4 has a half-life of 4 hours, less than 4 hours. And MK7 has a half-life of 72 hours. So it means that MK4 is going to remain in the body for a very short amount of time. But MK7 is going to remain in the body for a long time. 72 hours means 3 days, almost 3 days. So now, if a person with allele 2 takes MK7, and if clearance rate is slow, if person takes it on a daily basis, guess what? That MK7 is going to have a backup. And in the system, in the human body, anything which backs up, it creates symptoms. So they will not jive very well with MK7-4. So MK4 is the better solution for people through the literature. But what I have come across, MK4 is a better option for people who carry allele 2. Now, for allele 3, MK7 is fine because I've been taking MK7 for years and I'm doing very well. I don't have any issue. But MK4, allele 4 people, if they take MK7, 100 microgram or so, they're going to clear pretty fast because the clearance rate is very quick. So they need more. And this is what I found out when I got tested for vitamin K2 for my wife. Now, remember that, vitamin K2 test is not readily available anywhere. I came across only 2 labs in the United States as of now who does this vitamin K2 test. Vitamin K2 is indirectly tested by Genova lab. Remember that, this K2, as I said, that, it takes the calcium from the blood, it takes it to the bones. How it does it? There's a mechanism for that. Because we have 2 types of proteins in our body, besides many proteins. One is osteocalcine, and osteocalcine protein plays a vital role in this bone remodeling. So when we have enough K2 at the cellular level, this vitamin K2 activates that osteocalcine protein, and it helps in carboxylation mechanism. And once it gets activated, it draws the calcium from the blood serum and takes it to the bone. And that's the transportation mechanism takes place. So it means that the main element here in entire bone matrix formulation is one major player is vitamin K2. So one has to be sure that you have enough in your system. Otherwise, this mechanism is not going to take place very well in bone remodeling. Now, one test is Genova Labs, which does it measures uncarboxylation of osteocalcine. So, and then there's another lab in California which does direct measurement of vitamin K2. And when I was giving 100 microgram to my wife, she came okay at the serum level, but she came short at the cellular level. So she was clearing too fast. And I verified through the literature. It took me about 6 months to dig it up, that information that, why both of us are taking 100 microgram and I was okay, but she was short. And because we carry both different ApoE genotype. I'm 3-3, she's 3-4. Now, some folks in the comment section in the previous vlogs ask me question, how much I should take if I am 2-3 or 2-4 or 2-2. So honestly, I cannot recommend anybody, but I can share with you the logic. So if somebody is ApoE2 3. So it means that 2 is slow clearance, 3 is typical. So you are lying in between slow and typical. If somebody is 2-4, then you are lying in between slow and fast. So always remember that, that's how you figure it out. My wife is between, she's 3-4, so my wife is between typical and fast. So she is taking almost 800 microgram. And last, acolyte, which we ran actually, and DEXA both, her osteopenia and osteoporosis has stopped. It didn't go worse as compared to the 2021. So it seems like to me that we have turned the corner. And hopefully going forward, it's towards the betterment, because the one missing element which I found out, it was K2. And even though she was taking it, but she was not taking it enough based on her ApoE genotype. So this is my practical, experience, and my best practice which I shared, and it's verified by the literature, which nobody is talking about. So make sure that you know your ApoE genotype, because we will be talking ApoE genotype quite frequently when we are talking about heart disease as well, because it plays a very, very vital role in the entire lipid system. All the cholesterol and everything is metabolized based on ApoE genotype, and it's once in a lifetime test. So I would strongly recommend, if you can do it, because you don't have to worry about the second time, because whatever the genotype you have it. Whatever you inherited from your mom or dad, that's what it is. You cannot change it. This is what it is. So I hope that you gain something out of it. And if you have particularly questions, comments, put in the comment section, and I'll try to respond. I apologize that it may have taken a little bit extra time, but I think this topic is so critical that I need to explain to you in detail a little bit that why all these small elements are very crucial to understand. And once you don't understand anything, then it's very hard to tackle the problem, because I personally, as I said earlier, that I would like our bones to grow organically from inside out, so that we can improve the fragility index. And that was my message today. And if you have any questions, please feel free to put in the comment section, and I'll try to respond it. Thank you. See you next time.